Marianne, I know you've worked at Google and Twitter and dealt with a lot of brands. What do you see the role of the multiple roles of brands in social media?
I think the brands have started to do a really good job of getting that connection with their consumers in a more direct way. So what I've seen, it started with education, so the brands really wanted to connect with the consumers. And to date, not being marketers for a very long time, right? 1997, right, being DTC kind of coming into the world, a lot of it was television and print, and I think there was always a lack of real connection in terms of the broader information. So digital afforded them the opportunity to make a connection directly with the patient who really wanted to learn more about a medication or a treatment, the benefits, the efficacy, the side effects, all of it. And the same is true for clinical trials, right? So we've seen that kind of recruitment being really effective because you can specifically kind of find those people who would be appropriate for a clinical trial. Same is true in terms of finding the people who potentially would benefit from your drug. So I think that the companies and the brands are over time becoming more sophisticated about their desire to connect in a meaningful way. So it's not advertising at someone the way I would say sometimes television can come across or even print can come across. It's more about that connection, like this is the information, learn about it, talk to your doctor, make an educated decision about your treatment and be informed so that you know what that path is that you're on.
Do you think brands also have a role and maybe even a responsibility to talk about the condition itself and sort of forget promotion for a moment and talk about lifestyle and things like that in social media?
Yeah, I think they do. I would never presume to say they have a responsibility to do it, but I think it benefits everyone in terms of getting people to understand that the companies actually do care about the conditions. And their public perception is often on par with tobacco companies, right? Which is such a shame because the pharmaceutical companies are developing drugs to improve lives and cure disease and all of these things. So the public perception, I think, has been a bit skewed. At Twitter, we've seen so many pharmaceutical companies really start with that corporate communication, like this is what we're doing. This is how we're involved in third world countries. These are the conditions that we care about. To be able to convey that in a way that they haven't before. They haven't had a platform before to do that. So they're doing that from a corporate communication standpoint, and then I think a lot of brands are interested in educating people about a condition because it's important that people really understand the condition. Sometimes it's asymptomatic and they don't understand it, right? Like I always say, like the perfect example of that is Bill Clinton, who obviously is intelligent, obviously had access to the best doctors in the world. Okay, maybe you don't agree, but politics aside, had access to the best doctors in the world and went off his statin because he just did. Right, and ended up in surgery. So, it's so important, I think, for the companies to make sure people understand these conditions, whether they are symptomatic or asymptomatic, and really are well educated about them.